in front of the same soccer ball. We're trying to make sure that there are not a lot of heavy breathing around a singular soccer ball with 5 kids around it at the same time. But for spread out activities, our outdoor mask guidance for unvaccinated people, small groups, allows for those kids to be unvaccinated. And what we really are trying to do is ensure that all of these kids can have a really good camp experience and keep the camps open without any outbreaks.
Next question.
Last question. Let's go to Zeke Miller at the AP.
Thank you, Dr. Walensky and Dr. Fauci. I was hoping you might be able to expand a little bit about what the U.S. will look like, assuming the vaccination rate meets and the caseload looks like what the best case scenario that CDC put out in the models this morning. The vaccination. The president hits his goal of 70% vaccinated, 160 million fully vaccinated by July 4th. What at that point, should people expect or hope for the country to look like, whether that be their mask wearing, businesses opening, sports games, restaurants, to the extent of, can you provide sort of a more of a reason for people to get vaccinated and to follow some of these mitigation measures in this 2-month stretch right now?
I can start with that and maybe just say, we're really looking forward to seeing that time. We're looking at both the rates of vaccination as well as the rates of cases come down. And it'll be the intersection of those two that we're really looking at. When we see that intersection, high vaccination rates, low case rates, we will look forward to releasing further guidance on releasing some of the restrictions that we currently have in place. One thing I want to just clarify here is, while we talk about 70% of this country, these outbreaks are local. They're happening in communities. And so if we don't have 70% in any given community, this virus will be an opportunist and will have outbreaks in those singular communities. So not only is it 70% across the nation, but it is 70% in each of these individual communities.
Dr. Fauci, anything you want to add to that?
Yeah, Andy, certainly, just to underscore what Dr. Walensky said, but also, to take a typical example, if you have a community, it's very important to realize we live in a large country, heterogeneous, and you're going to have different rates of vaccination, different levels of infection. But if you are in a particular community, a town, a city, or what have you, and you have the 70% vaccination that the president is aiming for with a single dose in adults, and you will see, guaranteed, the level of infection go very low, you can start looking at things that you were restricted from doing, that gradually you will see the CDC lifting the restrictions. That would be anything from indoor dining to the workplace, to sports arenas, to theaters, to things like that. I don't know exactly which it's going to be and which will come first, but the bottom line is you will be seeing a clear, noticeable pulling back on some of the public health restrictions.
Great. Let me close with my thanks, my encouragement for everybody to get vaccinated, and of course, by reminding you once again that all you have to do is text your zip code to 438-829, and you'll figure out where to get vaccinated, and we will be talking to you again on Friday. Thank you.